Quick note. This is an automated educational summary of public medical sources. Mayo Clinic, the NIH, and Medline Plus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. If you're wondering how much an STD test costs, you're not alone. Thousands search for this every month, and the answer might surprise you. Testing is often more affordable than people think. Costs can range dramatically depending on where you go and what's covered. But the good news? You have options. In this video, we're breaking down exactly what these tests cost, how they actually work, and the easiest ways to get one. No embarrassment, no waiting room drama. According to the CDC, regular sexual health screening is recommended for anyone who's sexually active. Medline Plus notes that many STIs don't show obvious symptoms, which means you could have one without knowing it. That's why testing is so important. Not as something shameful, but as basic preventive care. Think of it the same way you'd get a regular checkup or a flu shot. The earlier an infection is caught, the better the outcomes. Testing gives you clarity and peace of mind. The cost depends on what you're testing for and where. According to Mayo Clinic, basic STI panels can range from $50 to $300 at urgent care or clinics. At-home tests start around $25 to $100 per test. If you go to a full-service clinic or use insurance, costs may be different and often covered entirely. The Cleveland Clinic notes that testing multiple infections at once is usually cheaper per individual test than getting them separately. Let's break down what you can actually expect to pay. You basically have three options: traditional clinics, urgent care, or at-home testing kits. Traditional STI clinics often offer the lowest prices, sometimes even free or sliding scale, and you get professional guidance. Urgent care is quick, usually 24 to 48 hours for results. At-home kits let you test in private, ship your sample to a lab, and get results online in 2 to 5 days. There's no single best option. It depends on your timeline, comfort level, and privacy preferences. All three methods are legitimate and widely used. The actual testing process is straightforward. For blood tests, a quick finger prick or arm draw, similar to any lab work. For urinary or swab tests, you collect a sample yourself or the clinic does it in minutes. Medline Plus explains that samples get sent to a lab where they're analyzed for bacterial, viral, or parasitic markers. It's the same standardized process used everywhere, reliable and routine. Results typically come back in a few days. The whole thing is quick, painless, and completely normal in modern healthcare. One huge concern people have is privacy, and it's completely valid. Here's what matters. Testing records are protected by HIPAA, whether you use insurance or not. At-home testing companies use encrypted systems. You can choose anonymous testing at some clinics. No ID required. Your results go directly to you, not automatically to anyone else. Insurance will show you received lab work, but your company's HR team won't see what you were tested for. If privacy is your main concern, at-home kits or anonymous clinics are your best bet. When your results come back, they're usually straightforward, positive or negative. If you test positive, that's not a diagnosis. It's information that needs professional follow-up. The CDC recommends discussing results with a healthcare provider, even if you ordered a test independently. Your provider can confirm the result, explain what it means for your specific situation, and discuss next steps. If you test negative, that's great. But remember, some infections have window periods. A provider can explain your specific timeline based on your exposure history. Whether your results are positive or negative, the next step is always talking to a healthcare provider. If you used an at-home test, take your results to your regular doctor, a clinic, or a telehealth provider. They can confirm results and discuss options. Most STI treatment is straightforward. What matters is not ignoring your results and getting professional guidance. Now, I want to hear from you. What type of health tests are you interested in? Comment below and we will make a video about it.